Hello, I'm Tony DeMaria, the editor of JACC, here with some highlights from our June 12th issue. And the first study is quantification and impact of untreated coronary artery disease after percutaneous coronary intervention, the so-called residual syntax score. And this comes from the acuity investigators in the acuity studies who applied the syntax score to their post-PCI patients. And if the patients had a residual syntax score of greater than 0, they were then subclassified into tertiles, and the ultimate event rate for patients in the various categories of either no residual syntax score or the various tertiles was examined. And the findings were, perhaps not surprisingly, that the 30-day and 1-year event rates were higher in the patients who had a residual syntax score than those who did not. And in fact, the residual syntax score was an independent predictor of 1-year events, mortality and other MACE. And in fact, a group of patients could be identified with a very high residual syntax score, greater than 8, in whom the 1-year mortality was extremely high. Now, the results of this study are provocative in that they suggest, again, that it's very, very important to achieve complete revascularization in individual patients. In addition to that, since the baseline syntax score was clearly predictive of the ultimate outcome of incomplete revascularization, surgical revascularization should be strongly considered in patients who have a very high baseline syntax score. Another study of interest dealt with cyclic AMP phosphodiesterase 4 and its potential role in protecting against atrial arrhythmias. And this is an interesting study that was done in human atrial myocardial cells. And what we know is that pacemaker activity is dependent upon L-type calcium channel influx, and this calcium channel influx clearly itself is related to the levels of cyclic AMP. And therefore, cyclic AMP may in fact predispose to atrial fibrillation if it's elevated. So in this particular study, they evaluated phosphodiesterase, that is specifically phosphodiesterase 4, which would reduce levels of cyclic AMP and presumably reduce the potential for atrial fibrillation. And what they found was that there were some very beneficial electrophysiological findings in these human atrial myocardial cells. And in addition, in a fascinating part of their study, they looked at levels of phosphodiesterase 4 in patients who were undergoing cardiac surgery and could give a sample from the right atrium, and found that those levels were depressed in the patients with permanent atrial fibrillation. So an interesting study that identifies phosphodiesterase 4 as a potential target to prevent or reduce atrial fibrillation. For Inside JACC, I'm Tony DeMaria.